Recording in
Hi, everyone. My name is Sarah.
And my name is Aishu.
We'd like you to consider, what does a world without preventable maternal death look like? At Astrea, we'll tackle this issue one hospital at a time by building a better world for birthing people.
Meet Aaliyah Porter, a 26-year-old software engineer. Giving birth to her first child was traumatic, so she's been anxious since finding out she was pregnant with her second. Despite her goal of having a healthy delivery, her fear and stress has made her wary of her new provider, and she's had elevated blood pressure during her checkups. Aaliyah is a great example of who we at Astrea, consulting firm, are designing for. Aaliyah's story is based on the maternal mortality crisis in the United States. According to the CDC, 4 out of 5 maternal deaths are preventable, and Black women die over 2.5 times more often than white women. Compared to any other developed country, the US has the highest number of women dying during and after giving birth. This has created a lot of fear and anxiety, especially in Black communities.
So, why is this such a sticky problem? Multiple factors contribute to the high rate of maternal death. While there's a lot of great work being done to address the biological causes, what remains are systemic problems, such as health disparities and access to quality care, including respectful and dignified maternal care. Astrea works at this intersection. We are targeting US birthing hospitals, which gives us a TAM of 863 million. If we break that down to the DMV, our SAM is 35 million. Assuming 5.7% market capture, our SOM is 2 million.
At Astrea, we redesign labor and delivery wards with the human element in mind to positively impact patient health outcomes. We start by mapping the patient journey and then implementing changes at touchpoints between patients, clinicians, and staff. This improves care quality and reimbursement rates while reducing staff turnover and readmission rates.
Our closest competitors are focused on research and program evaluation. Other consulting firms that have healthcare practices do not exclusively focus on maternal health. Astrea is different because our approach takes a holistic view of health and redesigns maternal health systems. We blend evidence-based practices from UX design, medical anthropology, engineering, psychology, and public health to co-create impactful solutions with our clients in the maternal health space. This is a unique method that no other firms are pursuing.
Our consulting services will be sold to DMV birthing hospitals. We charge $100 per consultant per hour, and each project requires 2 consultants, so a 3-month contract would cost about $96,000. While we're focusing on the DMV for now, our future pipeline will involve expansion of our services across the United States. Currently, we're finishing up JHU's Spark Accelerator program, and so far we've interviewed a handful of people in the industry. We've also attended a reproductive justice conference in Maryland. Our greatest need is to expand our network to assess market appetite for our service. Going forward, in December, we'll focus on conducting interviews and applying to other accelerator programs offering non-dilutive funding. Q1 of 2025, we'll create a legal structure, recruit an advisory board, and develop our product. In Q2, we'll create our marketing, find initial customers, and launch a pilot project.
The team is made up of the 2 co-founders who met in the Johns Hopkins MPH and MBA dual degree program. I have a master's in medical anthropology and have experience consulting with an OBGYN practice in North Florida. Aishu has a background in healthcare consulting and health equity projects. Thank you for your time, and we welcome you as partners in our journey in making a difference for patients like Aaliyah and building a better world for birthing people.